Hello, my name is Rebecca Catano and I'm a scientist. This is my assistant, Madison Harrell. She is a doctor. She's going to help me while we research for progeria. We found a child right here. We found two children. This is Albert. He is 2 years old. And this is Alexandra. She's also 2 years old. They both have progeria because they have protruding eyes, prominent ears. She has a small chin as well as a small mouth. Her nose is beak-tipped and she is bald. Both of their skin looks like it's wrinkled as an old person would have. And as well, like you can see here, he's got the nose-beaked tip, like the beak-tipped nose. His mouth is small, his chin is small, and his ears point out. Progeria is the rapid aging of children, and it is a mutation, a genetic mutation from the LMNA gene. It is also dominant.
Progeria is also very fatal and a sad genetic condition. Children usually don't live older than 13.
90% of children with progeria has a mutation in the gene that encodes lamin A. That is a protein that holds the nucleus cell together. The lamin A protein malfunction is believed to make the nucleus unable to work.
Like in this picture.
In this picture, the cell is normal looking, and
this
that
is a cell with progeria.
You can tell that the nucleus right there, the nucleus is unstable. It is not as prominent as that one over here. It is mutated looking. It's very
out of the ordinary.
Yes. Thank you, Madison.
Some complications include heart disease, hypertension, other known as high blood pressure, strokes, angina, enlarged heart, and heart failure. These types of complications are such as elders deal with too.
Because it is a genetic mutation, it cannot be treated and it cannot be fixed. It's in the gene that it is what went wrong, and we cannot do anything to fix that. That is what we are trying to do. It is very fatal and it's sad. Children don't usually end to be 13 years old.
Ways to help relieve the internal effects is by taking aspirin.
And phenyl transferase inhibitors. Those are used to treat cancer, and it is believed that this could improve some of the symptoms of progeria. Progeria is also known as progeria of childhood, HGPS, and progeria syndrome. The word progeria comes from the Greek word progeros, which means prematurely old.
They can be tested through genetic testing. And anything else?
I don't think so. What we know right now is that it's genetic. It cannot be fixed. We are trying to find a treatment, and we are trying to figure out what we could do to fix it. So far, we've only found that we can use the phenyl transferase inhibitors,
or FTIs for short.
And that's it.
If you know anybody with progeria, know that you probably will not see them ever again. Please respect and care for these children. They're treasure.
This is Rebecca Catano again, and this is Madison Harrell.